Kristen.
Hi.
I'll be your nurse today. Can you confirm your name and date of birth for me?
Bryce Linneman, October 4th, 2000.
Excellent. So today we're going to be doing a cognitive test. We're going to be looking at your cognition, sensory, cerebellar, lymphatics, chest, cardiac, and peripheral pulse assessment.
Okay.
So first thing I'm going to do is, can you describe where you are?
I'm at my house in Loveland, Colorado.
Excellent. Can you tell me what the date is?
June 27, Saturday.
Very nice. And can you tell me where you go to school?
Grand Canyon University.
Awesome. So our patient is alert, oriented, seems to be in an appropriate affect, and well-groomed. Next, we're going to do your sensory test. So I'm going to have you close your eyes, and the first thing I'm going to do is a detection test. So tell me when you feel me touch you. Ready?
Now. 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 Now.
Good. And I would do this on both sides, but just one side for this video. Next, I am going to do a graphaphasia test.
Okay.
So I'm going to have you close your eyes, and I'm going to get something for you to describe to me. All right, open your hand.
A ring.
Yes. Very nice. All right, and lastly, we're going to do a stereognosis test.
Okay.
I'm going to write a number in your hand, and I want you to tell me what it is.
Okay. One.
Try again. It's a double-digit number.
Oh, 11?
There you go.
Okay.
Very good. So sensory looks good. We're going to move to the cerebellar portion. So the first thing we're going to do is a finger to nose test. So I'm going to have you touch your nose and touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Nose. Finger. Nose. Finger. Good. Very nice job on that. Next we are going to, I want to see if you can slide your heel down your shin.
Okay.
And the other side. Good. Good coordination. Next we are going to do a walking gait test.
Okay.
So if you want to stand up, and I'll have you come back here. And can you take 5 steps towards the camera? Good. And back. Good. And now just on your heels. Nice. And on your toes. Very nice. Good job. That looks excellent.
Okay.
So the cerebellar portion looks very nice.
Okay.
You can go ahead and have another seat. And next we're going to do the lymphatic system.
Okay.
So I'm going to palpate your facial lymph nodes.
Okay.
All right. So we have the preauricular, the postauricular, the occipital, the submental, sublingual, tonsillar, superficial cervical, posterior cervical, supraclavicular, and infraclavicular. Nice. I did not feel or palpate any swollen lymph nodes and no rubbery lymph nodes either.
Cool.
So next we are going to move into the chest assessment. So
Okay.
Our patient already has her shirt off. Her skin looks good. She has a little bit of acne related areas. I know that's hard to keep under control for you sometimes. But otherwise looks very nice. No diuresis and no discoloration there. So we're going to do a tactile firmitis test. So if you want to spin around here.
Okay.
I'm going to have you say 99.
99.
Good. Again.
99.
And again.
99.
And again.
99.
Good. Nice equal vibrations there. Feels really good. Next we are going to work into the auscultation portion. And I would do anterior and lateral, but for this we are just going to do posterior. So I'm going to auscultate in a Z pattern formation. All right, go ahead and take some breaths for me. Excellent. Breath sounds are clear and equal, and I'm going to work into an egophony test now. So I'm going to have you say E.
E.
Okay, and again.
E.
Good. Again.
E.
Good. Again.
E.
Good. One more time.
E.
Good. And one more.
E.
Good. So no muffled, I heard muffled E sounds, no A sounds. So that's good. She's negative for egophony. Next we are going to work into the cardiac portion, so you can go ahead and spin around. Actually, I'm going to have you lie down supine on the bed, please.
Okay.
Okay. So first thing I'm going to do is palpate for any thrills or heaves. Good, no thrills or heaves. And next I'm going to also take for descriptors, the APET-M descriptors. Alright, so first is the aortic at the second intercostal space on the right sternal border. Good. And the pulmonary at the second intercostal of the left sternal border. Good. Erb's point at the third intercostal of the left sternal border. Good. Tricuspid at the fourth intercostal of the left sternal border. And the mitral at the fourth to fifth intercostal of the left midclavicular line. Good. Nice heart sounds.
Thanks.
Good rhythm. Okay, so lastly we are going to do, I'm going to check your pulses.
Okay.
So first I am going to start with your temporal pulse. Good. And your carotid. Good. The radial. Good. The anterior tibialis, posterior tibialis, and the dorsalis pedis. Good. And I would palpate for both sides, and hers feel like a +2. And I would also compare them, making sure that they're both equally graded at a +2. All right, I think that's all. You look great.